Hello, welcome to the volunteer training video for contact lens insertion and removal. First, seat the patient in front of a mirror and find out if they'll be wearing soft lenses or ortho-K lenses. For ortho-K patients, let them watch the Paragon video, and for soft lens patients, show them the AccuView video. During the video, you can set up the counter as shown. The setup includes paper towels, pen and paper, and the lenses. You may ask Dr. Tang for the lenses. Soft lenses will come in their package, whereas for OK lenses, place them inside a lens case filled with the Boston Advanced Conditioning Solution. Also prepare a plunger for OK lens patients, which will be used during removal. After they finish watching the video, make sure they've washed their hands. Then you can go through the following diagrams and instructions with the patient, making sure that you're drawing out the diagrams on the piece of paper. Generally, our eyes look like this, and it would not work if we tried to put our contact lens in. So what we want to do is open our eyes as big as possible so the lens can fit in. Next, we will go over some steps on how we can insert our lenses successfully. Here, you can ask the patient if they're left-handed or right-handed. For the demonstration of this video, the patient will be right-handed. The first step is to pull down with your right middle finger until you see the red section of the lid. In addition to drawing out the diagram, you can directly demonstrate the action to them and ask them to repeat it. While you're observing them, make suggestions. Ensure that their finger is right by the eyelid under the lashes. Watch them pull down the eyelid and count to 5. The second step is to use your left hand to pull up your upper eyelid and eyelashes until you can see a white space there. Again, make sure their finger is close to the lid and lashes as possible, and watch them pull up the eyelid and count to 5. Next, join the first 2 steps together. We should be able to see a white on top and red on the bottom. Make sure both hands are right by the eyelid. One tip is to wrap their left hand over their head. Watch them hold open the eyelid for at least 5 seconds. Now, while holding open both eyelids, try to put the index finger on your right hand close to your eye without touching it. Repeat a few times until you're comfortable with this motion. After completing all the steps, they should be ready to insert the lenses. The doctor may put a drop of anesthetics in the patient's eye to improve the comfort of wearing. Once ready, ask the patient to rest the contact lens on the ball of their right index finger. Make sure the finger is dry or the lens will stick to the finger. Transfer the contact lens to the other hand and dry the finger if necessary. Now, just like they practiced, they should be able to hold open their eyes, seeing white on top and red on the bottom, and insert the contact lens gently and slowly. They may not succeed the first time, but watch them carefully and point out what they're not doing correctly. Oftentimes it is because their fingers let go as soon as they get close to the eye. Also remember to give encouragement. Next, we'll go over how to remove the contact lens. The process is a little bit different for soft lenses versus OK lenses. To remove soft lenses, hold open both eyelids as before and remove the contact lens using the index finger and thumb. It is recommended that the patient first slide the lens to the white part of the eye before removal, as to avoid scratching the cornea. For ortho-K lens removal, demonstrate the usage of the plunger using the plunger case. Instruct the patient to hold the plunger with the tip of their dominant index finger and thumb, with the plunger portion facing towards them. Make sure the plunger is demonstrated flat facing towards the center of the lens, as pressing it at an angle would not apply the suction properly. Before they begin, tell the patient to keep their eyes straight forward while they pull down the upper and lower lids, repeating the same process as insertion. Then move the plunger towards the center of their eye and press the plunger gently on the lens. Once pressed, hold the plunger firmly for 3 to 5 seconds in order to make sure that the suction has been applied, and gently pull the plunger away from the eye. To remove the lens from the plunger, gently twist the lens away.